Hi, I'm Dr. Michela Nelson. I am a Naturopathic Doctor here at Neurvana Health. I chose to pursue naturopathic medicine as a career path because I used to suffer from chronic TMJ pain, and it was through discovering alternative ways to receive symptomatic relief. I just found that alternative medicine ended up being very successful for me, and I got really curious as to why. How does this all work? And so I just decided that I wanted to study naturopathic medicine because of that. I'm really passionate about helping women navigate the different hormonal transitions in life, and have become really passionate about perinatal medicine specifically, which involves fertility, pregnancy, postpartum, and also I enjoy helping women through their perimenopausal transition as well. And I think it's really important for women to know that we don't have to grin and bear it anymore. We can talk about it, we can get help, and just learn to thrive in each stage of life. These areas of health matter to me because I've experienced them personally, and I personally have gone through 3 pregnancies myself, and so I feel like I can walk alongside these patients with a personal and professional perspective that I think is unique, and also it just gives me that experience and empathy to really relate to these patients. So in the past 2 years, I actually completed an additional 1-year fellowship in perinatal medicine, so I feel way more up to date and well versed in helping this particular patient population. As a new patient of working with me, you can expect to have active listening, genuine empathy, and I would say collaborative care. I can provide all the expertise and the knowledge, but it's really the patient and you that's in the driver's seat. And we can work together to create a plan that works best and is most sustainable with your lifestyle. In terms of the timeline of when should you be seeing progress, I would say that it depends. It's dependent on what we are working on. Things can turn around within as little as 1 to 2 weeks. However, lasting change, of course, takes much longer, and we want to make sure that at each follow-up visit, we're meeting the goals that we together have set out for your health plan. And so the goal, of course, is always to improve after every single visit, but some things do take time, and I will make sure that you understand what the appropriate timeline is to expect these results that we're looking for. The thing about naturopathic medicine is that it really is for everyone. It's such a spectrum of care, and it particularly shines with preventative medicine or prevention. It particularly shines with prevention of chronic health conditions. And so I would recommend anyone to just give it a try and see what kind of benefit that you can get from naturopathic medicine. Okay, so what brings me joy outside the clinic are, of course, my kids. I have 3 of them. But a very close second would be travel. I love going to new places and just making new memories. I think travel just allows you to slow the passage of time, which I like to do with my kids. I think I'm on day 1400 of my Duolingo streak. So if anyone else is on Duolingo, I am learning Spanish currently, and sometimes I dabble in French. Not as good as that language. I also am an avid collector of Starbucks mugs from any place that I've traveled to, but I've had to stop that hobby because I ran out of cabinet space. So no longer doing that one, but doing Duolingo, going strong. So one piece of health advice that I would give to anybody, which doesn't really sound like health advice, is being a great historian of your own health. So that would look like on your notes app, you're writing down your symptoms on a daily basis at the time that the symptoms are occurring, and if required or helpful, I would take photos and videos of anything that is going on with you, because it makes it so much easier to get the care that you need from your practitioners, and it expedites the process quite a bit. So that would be my recommendation to anybody.